Hi, I'm Aimee Foord. I'm the director of the Bleeding and Clotting Disorder Clinic at Cure for the Kids Foundation. Other factors that can be low are factor 8 and factor 9. And when factor 8 is low, that's called hemophilia A. And factor 9, when that's low, that's called hemophilia B. Now, you may have heard of hemophilia in books or with the royal family in England, but the way it's inherited is on the X chromosome. And so for hemophilia, males typically have the disease because males only have one X chromosome. Females can be a carrier of hemophilia. And the thing with carriers is that you still can have levels the same as a hemophiliac. So carriers can have mild hemophilia, but some carriers don't have any symptoms. So if a newborn has bleeding after a circumcision, if a newborn has bleeding after their umbilical cord falls off, or if we're lucky enough to know that hemophilia runs in the family, we're very quick to consult on those patients that have bleeding or have family history of hemophilia before they have any bleeding. There's multiple ways to treat hemophilia A and B now. Most of it is with replacing the factor that's missing or tricking your body into making the factor that works. There's new up-and-coming treatments for both hemophilia A and hemophilia B called gene therapy, where your genes are actually modified in a lab to create the real correct factor 8 and factor 9. Those treatments are very exciting because we've never had a cure for hemophilia A or B. We've always just treated with factor. The reason why we treat with factor is to prevent any bleeding, because being low in factor 8 and factor 9 is very risky and dangerous for just spontaneous bleeds. Hemophilia patients get bleeds in their joints, really bad bruises, and it can just be spontaneous, not just after a surgery or after a trauma. So they need prophylaxis all the time. But now with the up-and-coming gene therapy, maybe we can have a cure for it.